Today, I'll be informing you about diabetes, type 1 and type 2. How many of you are comfortable getting shots at the doctor's office? Now imagine having to do that every day. People with diabetes often have to take 3 to 4 shots each day. I am credible with diabetes because my dad has had type 1 diabetes ever since he was 14, and I've had to deal with helping my father with a lot for most of my life. Although many of you may never actually have the disease, diabetes is a threat to global health and is becoming an epidemic throughout the world. According to the Centers of Disease Control and Prevention, around 30.3 million Americans have diabetes. Diabetes is separated into two groups, type 1 and type 2, both having many effects on those diagnosed. In this speech, I'll be telling you about each type of diabetes and the effects of the disease. Now, what is diabetes? Diabetes is a disease where the pancreas produces very little or no insulin, or the body does not respond to insulin appropriately. Insulin is made in the pancreas and allows your body to store glucose or sugar in the liver from carbohydrates you consume. When sugar levels in your blood are too high, insulin stores it and releases the sugar when it is too low. Someone who just ate a donut or candy bar would excrete insulin in order to store the excess sugar in their bloodstream. Insulin in turn regulates a person's blood sugar levels from getting too high, causing them to be hyperglycemic, or too low, also known as hypoglycemic. Glucose is the main source of energy for muscle cells and other tissue cells. Without insulin, someone with diabetes would become hyperglycemic very quickly because the sugar would build up in their bloodstream without being absorbed. Now that we know what the disease is, we can now go into the different types of diabetes. The first type of diabetes is type 1. According to Mayo Clinic, type 1 diabetes, also known as juvenile diabetes or insulin-dependent diabetes, is when a person's pancreas is unable to produce insulin or produces very little insulin. Usually the body's own immune system mistakenly destroys insulin-producing cells within the body, making it unable to produce insulin. Those with type 1 diabetes have to take around 3 to 4 shots of insulin per day. So they have to use these little syringes to insert the insulin into their body. And another alternative to insulin shots is insulin pens. And these are basically the same thing as insulin syringes, except they just have removable caps, and you don't have to use a different syringe every time. And another alternative is insulin pumps. And this is where you have like a little device connected on your side through a little needle, and the device will then pump insulin into your body. Like if your blood sugar is too low, then it'll or if your blood sugar is too high, it'll pump more insulin, and if your blood sugar is too low, it'll pump less insulin. It's unknown the exact cause of type 1 diabetes. However, many scientists believe type 1 diabetes is caused by genes and environmental factors such as viruses that may trigger the disease. Some risk factors with type 1 diabetes is family history, and that people with parents or family are at higher risk of developing the disease. Genetics is another risk factor, and for those with specific genes, it increases their risk of getting type 1 diabetes. And lastly, age affects. It can be a risk factor in type 1 diabetes, in that in the age ranges of 4 to 7 and 10 to 14, you're more likely to be susceptible to type 1 diabetes. Symptoms of the disease include increased thirst, frequent urination, extreme hunger, unintended weight loss, irritability and mood changes, fatigue, and blurred vision. Some long-term effects of type 1 diabetes includes heart and blood vessel damage, nerve damage, kidney damage, and eye damage. The second type of diabetes is type 2 diabetes, formerly known as adult onset diabetes. Mayo Clinic defines type 2 diabetes as a chronic condition that affects the way your body metabolizes sugar. Unlike type 1 diabetes, where the body is unable to produce insulin, in type 2 diabetes, the pancreas usually produces some insulin. However, the amount produced is either not enough for the body or the body cells are resistant to it. According to WebMD.com, type 2 diabetes is the most common form of diabetes and it accounts for 95% of all diabetes in the United States. Type 2 diabetes does not always have to take, people with type 2 diabetes do not always have to take insulin as those with type 1 diabetes do. With type 2 diabetes, blood sugar levels can be maintained through dietary changes, physical activity, and some oral medications. Causes is also unknown. The exact reason why the body becomes resistant is unknown, although genetics, environmental factors such as being overweight and inactive seem to be contributing factors. Some risk factors with type 2 diabetes include being overweight, fat distribution, inactivity, family history, race, and age. Symptoms of the disease of type 2 diabetes include are similar to those of type 1, such as increased thirst, frequent urination, increased hunger, unintended weight loss, and fatigue. And some long-term effects are heart and blood vessel damage, nerve damage, kidney damage, slow healing, hearing impairment, and skin conditions. After clearly examining both types of diabetes, we can better understand what those with the disease go through. In conclusion, today I've told you about type 1 and type 2 diabetes, along with the effects that come with the disease. Diabetes is a disease with no cure that affects millions of people in the United States, but if we are well informed of the different types and their effects, we can make smart decisions to help prevent and maintain the disease.